Okay, are you ready, Dr. Nilesh? Perfect, yeah.
Do you hydroimplant ions while using BX ring? Why not? Most of us think, well, we need viscoelastics to explant the BX, then why hydroimplant the IOL? Hydroexplantation of BX ring is not as difficult as you think, or is it? Let's see a few examples. Here under the
Hello
continuous
friends.
irrigation mode, we are going to hydroimplant a hydrophobic acrylic IOL, and just checking the trailing haptic, we are going to hydroexplant the BX under the irrigating solution as well. So what we do is we go with the BX ring forceps, try to disengage the flange, try to disengage the BX ring in its entirety, and leave it at just you see it starts spinning. So what you do, you stop your irrigation, you just grab the BX ring from one of the vertices, and by instinct if you press on the irrigation, then it again starts spinning. So stop the irrigation and pull it out. But is it the ideal way? Let's try another way. Here we disengage the flange. We do not leave the flange at all. So we are preventing the spin, but still you see it's really traumatic because the other disengagement is not as good as it should be. So what we do next? So on the third try, what we do is we do a mix of both. We go from the main port, we try to disengage one of the flange. Let the other flanges be at its place. It's in the continuous irrigation mode, so you have a good chamber stability. Grab from one of the vertices and now try to disengage from all the flanges and just pull it out. It will be as simple as that. Thank you.
Thank you.
Thank you.
Dr. Parikshit.
Uh, it's multiple videos. So how many have you done together?
Sir, I have did hydroexplantation of 5 BX ring I have done, sir. So these are the three. It was a learning curve, but in the end, I got the
Measured
thing.
endothelial cell count before and after when it was done?
No, sir, we don't have the facility at our center, so couldn't do.
Excellent idea to remove it for those who find it difficult and are struggling while removing it. Actually, as you keep learning this technique of using the expansion device, it's not the removing that's difficult. I personally found the learning curve for insertion, for putting it, for tucking all three very difficult initially.
Yeah.
So, but removal was never that much of a challenge.
The removal was a challenge for the toric IOLs, ma'am, because if we are just for removing the BX, if we have to inject the visco and then we get a rotation, it becomes difficult because there is a small pupil. So that's why we started hydroexplanting the BX.